New research shows many Americans with depression and anxiety feel mental health medication treatment is still a one-size-fits-all. Now, here to discuss why more patients are seeking personalized care and how genetic testing may help inform treatment decisions is board-certified psychiatrist Dr. Crystal Nelson. Good morning, Dr. Nelson. How are you?
Good morning. I'm well. How are you?
I'm doing great. Thank you so much for asking. So let's talk about this in more detail. Many patients say mental health treatment feels one size fits all. From your perspective, why is personalization so important in mental health care today?
Well, mental health care is highly individualized. What we know works for one person just simply may not work for another person, yet patients feel like their mental health care treatment is one size fits all. In 2026, the GeneSight Mental Health Monitor survey showed us that 88% of patients said that they would feel more confident in their mental health care if it were more personalized. So we know that personalization really matters when we are talking about symptoms, side effects, treatment responses. This can just vary so significantly from patient to patient. And so if we can begin to customize and tailor these treatment plans, hopefully we can get more informed conversations and just an overall better treatment experience.
So how can tools like the GeneSight test help inform treatment decisions and potentially reduce the medication trial and error process?
Yes, oftentimes for patients, this treatment process or choosing a medication can be a long trial and error process that can be very frustrating for patients and clinicians both. Only about 13% of patients previously treated for depression and anxiety said that the first medication actually worked for them. So using something as simple as the GeneSight test, which is a simple cheek swab that can be ordered in the office by the clinician, where the clinician can get back information about how the patient's genes might impact the medication outcomes, again, creating this more personalized and customized treatment approach to care.
So what conversations should patients be having with their providers if they feel their mental health treatment plan isn't working for them?
Well, first, it's always important, of course, that a patient not stop or manage their own medications without talking to their healthcare provider. But hopefully a patient would feel empowered to talk to their clinician if their treatment plan is not working for them. They could simply ask their treatment provider to order something like the GeneSight test, a pharmacogenetic test. If they are uncomfortable, they could also go to genesight.com and get a clinical discussion guide that might make that conversation just a little bit more easier to have in the office.
Yeah, what other kind of information is available at the GeneSight website where patients may be able to feel more informed and also learn more about the various options to them?
Right. So first, they could always, of course, just ask their clinician for a GeneSight test. But again, go to the genesight.com website where they can learn more about the test. They could also even locate a local provider that may be able to offer the test if their current clinician is unable.
Are there any other words you'd like to share with our viewers who may be struggling with mental health, with anxiety this morning on the show, and maybe speak to them in terms of the other help that they can get and is afforded to them?
Absolutely. So this is Mental Health Awareness Month. So if you are dealing with mental health concerns, please reach out to your local provider, your primary care provider, someone to let them know that you are suffering. If you find that the first person is not the best fit, just keep going to find the right provider for you so that you can alleviate this suffering and you do not have to suffer in silence.
Dr. Nelson, thank you so much for your time and thank you for those words of encouragement for our viewers at home. Appreciate you.
Thank you.
Now get personalized mental health treatment, and for more information, visit genesight.com.